Good to go.
Thank you so much. Good morning, good afternoon, good evening, depending on where you're joining us from. My name's Oyindamola Faithful. I
You can mute yourself.
Okay, great. Good morning, good afternoon, good evening, everybody. My name's Oyindamola Faithful. I am the Associate Director for Arts in Medicine Fellowship, and I am the host of this roundtable today. I am joined by three amazing speakers who will be contributing to this conversation around the future of arts. For many of you, I'm sure you've already read their bio, but for those of you who have joined without reading the bio, I'm going to drop a link in the chat so that you can get their full bios. And I'm going to do a short introduction on each of the speakers so that we can get into the meat of the conversation that we're about to have. I'm joined first by Clyde Valentin, who's based in America and is the co-founder of One Nation, One Project. I'm also joined by Aline Nogueira Haas, who's the associate professor at the Federal University of Rio Grande do Sul, and Kunle Adewale, the global development lead for the Global South Arts and Health. I will invite each of the speakers to speak for around 5 minutes to contextualize some of their experiences before inviting the panel into more of a conversation and then a question and answer at the end before hopefully being able to round up some of the speaking points. I think I'm going to go in in alphabetical order, and that means we will kick off with Aline. So Aline, over to you.
Hello, everybody. Hi from Brazil. It's morning here. Good afternoon, good night. It's good to see you all, and thank you very much for the invitation. Thank you, Oyanda, for inviting me. It's a pleasure to be here with Kunle and Clyde and share and talk about the future of arts and health. I'm gonna share my slides. Let me see. Um, um, Stop sharing. Oh, the way that here. Sorry, I'm trying to share like my notes without you seeing my notes, but I think I'm gonna do like this. Yeah. Okay. As Oyanda said, I am an associate professor in dance here at the Federal University of Rio Grande do Sul in the south of Brazil, but I am also a Global Atlantic Fellow for Equity Trinity College Dublin in Ireland. Uh, I'm gonna start talking a little bit about Brazil because this that we have, and you can see here, Brazil is really, really big. Brazil is the largest country in Latin America that give rise to an extraordinary cultural richness and diversity. Brazil culture is not homogeneous, but rather a vibrant mosaic of influences that you can see on the map of indigenous roots. Brazil, this diversity expressed through a wide variety of regional traditions, folk arts and cultural practice, which together uh, shape unique, deeply rooted in everyday life. The arts occupy cultural legacy that is both dynamic and proudly rich. Arts and health is an emerging area, an emerging field in Brazil. Arts and health is relatively new in Brazil, but we are expanding the arts and health area in different environments like hospitals, festivals like Global South Arts and Health Festival, international festivals, and local festivals really help us to create visibility and network to the arts and health field in Brazil. One thing that I would like to just say to you, I'm here to represent Brazil and explain a little bit how we are working in this area, that we have the biggest public health system Brazil is the only country in the world with a people that have a universal. Then this national health service provides a foundation for integration of our health across the population with the country's rich and diverse cultural traditions, create a ground for innovative health and culture. In this public health system, that they consider to work what we call complementary practice, the PICs. And then this integrative complementary they are officially include arts and health based in and 24 dance, circular dance, and other kind of visual arts and other arts and health that is included in this public health system in Brazil. Other thing that I would like to highlight, because I don't have so much time, is like to say to you that we have 165 subscription only from Brazilian population for many years. I am really happy to be here and to have this number of people together gathering and discussing arts and health in this festival. But most of these participants southeast of Brazil, means we need to develop more. Can you hear? Can you still hear me?
We can.
Oyanda?
I think now we might have lost you. Can everybody hear me?
Not sure if cut.
Oh, okay. So Aline, it's breaking up ever so slightly, but maybe I'll
and most of the topics.
Yeah, I think there seems to be a bit of a delay. So maybe we can.
I'm going.
Okay, maybe we'll continue on with Clyde, and then we can touch some of the end.
I am using my phone data because I am in the event now. Okay, to Clyde. I'm gonna stop sharing. Okay, great.
All right, Clyde, over to you.
Thank you. So let me just pull up my slides here. Good morning, good evening, good afternoon, wherever you are on this giant home we call Earth. Firstly, I'd like to say that my practice is as a multidisciplinary producer and creative. So I've worked across various disciplines from theater to performance to live events to the visual arts in highly collaborative fashions for well over 2 decades at this point. I came to this work alongside my colleague Lear de Bessonet, who is a theater maker and director out of New York, and a mutual experience that we had working on a large-scale participatory theater arts project where we saw really profound transformations amongst the individual participants and community members who worked on this project. So our goals when we coalesced around One Nation, One Project and Arts for Everybody was to activate new forms of collaboration, new types of collaborations for people, amplify local narratives, the work that was taking place across the country already. For many of us, this type of work is not new. If we're practitioners, dedicated to serving community, this is what we've been doing for a lifetime. In the context of the United States, we wanted to help advance health equity and achieve transformation. While working on that project, which is called Public Works, we worked with a cultural anthropologist who was our researcher, Dr. Shirley Bryce Heath, and she had a formula that she sort of shared with us about how to achieve transformation. And that formula is three components. Um, a group enterprise at scale, a high stakes environment, and a safe environment. So group enterprise, high stakes, and safe. So those are the conditions that we were hoping to create in and around this project. We often say that the opposite of, a high stakes um, group enterprise that is not safe is often war. So transformation in itself is not necessarily inherently positive. It's really about the conditions, right? So for us, creating a national context where individual collaborators in each place, from Providence, Rhode Island to Honolulu, Hawaii, from Seattle, Washington, down to the Deep South in Gainesville and Utica, Mississippi, and Phillips County, Arkansas, really needed to be nurtured for us as a national team. And, the United States is also geographically quite large, incredibly diverse. So we were working with, multiple geographic and cultural distinctions. And, we had to create a container that people felt comfortable working in. So, our project was designed to activate a moment where each of these communities, effectively on the same day, which was July 27, 2024, simultaneously premiered their projects that they had been working on mutually with us. So, on that day, we spanned six different time zones across the main 48 states, including Hawaii. It was a profound day for us, for all of us who were part of this experience. Underlying this work was also important research, where we wanted to make that research useful to both the communities and to the field of arts and health, which is also an emerging sector within the United States. Our principal research question was this: how can arts participation affect social cohesion and well-being in American communities? Our research was for the cohort members themselves. So if something was not useful to a particular community, that was not imposed, and it was not acted upon in terms of energy and effort on a local level. The research was also for our partners and investors, those who wanted to learn more or think about their own strategies beyond the timeline and scope of this project, which has since sunsetted, for our fields, the arts and culture field within the United States, the public health sector, and local governments, because our system of government in the United States operates at three levels with some degrees of autonomy: the federal government, the state governments, and then the local municipalities. And it's really on the local level where you can realize and affect change through policy, because those oftentimes are the folks who are most responsive. So we had a number of mayors and council people supportive of these projects across several of the cities and towns that we worked with. And finally, for sort of the U.S. nationally to serve a narrative around the importance of arts and culture in our country, as well as the general public. Our theory of change study, this is just sort of a quick scan. 21 focus groups, 2 surveys that spanned close to 16,000 participants, several on-the-person street interviews, 32 in-depth interviews, and a synthesis of prior evidence, which produced our first peer-reviewed paper, which was an updated definition on what arts participation actually means and includes. And you can find these studies on our website at artsforeverybody.org. What we have generated, several plain language reports. It was important to us to move beyond the academic realm of what our knowledge and what we were learning. So, transfer of knowledge was very important as we were learning. So we often took our peer review papers and rewrote them to a different reading grade level, and published those independently of the peer review papers and posted those on our website. So again, we were making very intentional efforts to foster accessibility to the knowledge that we were generating in the spirit of our goals. We were published in several peer review papers. Our last paper will be published by Leonardo, which is a MIT publication this upcoming December. That will also be posted on our website. We have one big report that's 200 plus pages long, where you can learn more about each project, our methodologies, both for research, but also how we formed this large scale group enterprise for this 4-year time span. And we also produced a number of distinct archival media projects, from a 5-episode podcast series. We commissioned one photographer who's the only person on our team who traveled to all 18 sites across the country. Those photos are available on our website, so you can take those in. So the future, where is this going? When we approached Dr. Jill Sankey, who many people know, Jill founded the Center for Arts and Medicine at the University of Florida. And one of their early convening projects is called the Community Health Conference. The first one was held in 2019. 100 people attended that conference. The conference I attended in 2022, there were approximately 200 to 300 people. The upcoming Community Health Conference, which we held this October in Newark, New Jersey, has over 500 plus participants attending. And the room will span, like this room, across academics, researchers, practitioners, the combination thereof, and just curious people or folks who are in a position to do something by way of policy and procedure. So this is where I see where we're going in the context of the United States, because we also concluded our project in the midst of a national election that is still sort of transforming our society within the United States. There is a shift towards more privatization and a gutting of sort of the public sector at large. So we believe, given the sort of outcome of the election, that we need to generate stronger private sector partnerships. The health sector in the United States is over a $4 trillion sector. That's trillion with a T. It is a huge sector. The case to be made here is that we know this work makes a difference, but it is slow work. It is transformative work. So these investments have to span decades. And that is nothing new to private enterprise that invests in research and development. So, the idea is, for folks to begin to realize that our system isn't necessarily sustainable from a for-profit context, and we actually have to invest more so in prevention. And this is probably one of the principal ways to do so. Um, our research work, we believe, has contributed to the momentum around additional research and longer term qualitative studies. So, specifically, how metabolically our bodies change and shift as we're participating in this work. Much of that exists, but within the United States, we actually need more of it to make this case. We need to continue to advocate, be active, and bottom line, just continue to make art as art makers and as creators. And finally, we need to develop in the context of a private marketplace, a hyper-capitalist society, more innovative social impact-based investment tools. And those conversations are also taking place in the country, driven by economists and market-based thinkers and investors. So if you want to learn more, please scan the QR code here, and I look forward to our conversation in the upcoming minutes. Thank you.
Thank you. Thanks so much, Clyde. Yeah, and I think we'll head quickly over to Kunle Adewale, and then start some of the conversation.
So I'm going to jump in very quickly. Just give me a few seconds and then we'll be good to go. So I wrote this short word while preparing for this segment today, which really focuses on future. So I say that the future is not linear, and so change is a gradual transformation, one line, one color, one surface at a time. The future is not something to rush. It evolves as we get involved, curiously, courageously, creatively, collaboratively, consistently until we see changes. So, yeah, I wanted to have a look at this picture in front of all of you today. Where should we start from? This is me way back some years ago, the pediatric oncology in Lagos, Nigeria, working with children who are actually going through chemotherapy in the hospital. Prior to this time in Nigeria, there is scarcity in terms of art and health engagement. There's scarcity or poverty of knowledge or collaboration, as you might call it. So there I was volunteering my time on a weekend as a primary school art teacher, but also spending my time on the weekend working with children. Not dreaming, but just doing in a way. And I'll probably try to like look at it within the context of what we're doing. Talking about the poverty of awareness, not knowing who is doing what, and not even having a basic understanding of what we're doing, and the poverty of knowledge or what that looks like in a way. Poverty of institutional resources to say, oh, there are institutions, but there are no resources to probably help to move the work forward. Poverty of institutional policy to say, oh, something has been done, so let's see how we move it upward and onward. A poverty of cross-sector or interdisciplinary collaboration to think about, oh, well, this is nice, this is good, how can we collaborate together? Those were not in existence in Nigeria way, way back. And for us, there's a necessity of a small group, kind of a grassroots mobilization where, from, me volunteering as a primary school art teacher working in pediatric oncology, and some of my friends who are artists who are even looking forward to say, oh, they would love to just probably volunteer their time to work in the hospital, to just share time working with kids or working with families and stuff like that. And through that process, what we saw was more of nurturing belonging and inspiring a future filled with hope and possibilities. And then what we've seen from there is partnership and progress with artists. And, throughout this period, like I said, there were no institutions, there were no individual to say, oh, this person is our mentor, or this person is leading us to lead this program. Those things were not in existence. So what we saw was more of pioneering work, was more of a pace setter work, was more of a ground grassroots work, with no one, with nobody but us, as a very small group in Lagos, Nigeria, actually. And what led what that led to was more of also capacity building, which I will probably speak to about in the short term. And in that capacity building is also character formation. Because for us, it's not just about saying, oh well, we're doing nice things and stuff like that. But again, there were challenges. But what were those challenges teaching us as individuals in the place of character formation and leadership, in the place of character formation, the place of being a citizen or civic engagement? What does that look like for us? And through those character formation, with resilience, with courage, with persistence, with humility in a way, and many many other factors that really help us to be able to get this work and get moving. Then city by city transformation and health system change and global movement as we're seeing today. So I would just give us, like, show us this collage of images of works and diverse engagement across hospitals in Nigeria, knowing fully well there were poverty of resources. I mean, if you go all the way back, for us, look at what it looks like art in health in Nigeria. This is probably what it looks like way back. But say it was, nothing really inspiring about it, nothing admiring about it, nothing really enticing about it. But afterward, when we start getting to meet and connecting and gathering, look at what we've done without the involvement of funding of government. I'm going to say that particularly to say, I mean, because talking about context of work, I mean, with a counterpart maybe in the West, in the US, in the UK, where there is funding through Arts Council, there's funding through the Arts for America and all of that. That is not the context in Nigeria. That is a different thing entirely. That, in a way, that it was just more of artists coming together to commit their time, to commit their resources, to commit their energy, to commit their passion, to make change happen right from the ground up. And what we're seeing today is transformation of spaces and places in the hospital. We've seen that even with some of our orchestra team performing, even with healthcare professionals in pediatric wards or pediatric oncology, or even in hospices, a home for the elderly people, in mental spaces for children and young people. All of these were not, mm, say, money funding. There was a big grant, $1,000 or $100,000 or £1 million to do a big research to make change happen. Nope. Everything from zero all the way to what you're saying today. And for us to see, because this is a reality in different parts of global south, where the focus is not it's not healthcare system change. People are more focused on, I mean, especially for those who are in leadership, they are more interested in how much of money they can maybe steal from the public funds and all of that. They're not really interested in what is going to happen in the hospital. It's none of their business in any ways. But change, and real change and health and well-being, becomes our business. So we're not going to wait for government policy before we start making progress that can really make change happen in the community that we belong to. So we've seen it's incredible engagement, even introducing immersive technology, working with elderly people who experience joy and improve cognitive, functioning, and how they express, themselves through diverse um, means of creative engagement. Talking about elderly people for the first time in Nigeria, having their works displayed in a private, prestigious art galleries in Nigeria without government funding, without private sector involvement, and all of that was coordinated by a small group of young people, or people who are really interested in seeing what the arts can do. And for us, so this for us is what we're saying in terms of demonstration in terms of civic engagement, which is for us is very paramount, is very key and very important. And how each one brings their instrument, brings their resources, to the center to say, this is what we have. How can we use what we have to get desired result? And we've seen desired result from improved lived experiences, improved change of life or quality of life for people who are going to commit suicide. We've seen how the music helped them to come out of the depression, and we've seen the progression from there through how we founded the Global Art in Medicine Fellowship Program. I mean, here I was way back, even working at the backside of the desert in Nigeria, working in the community where there were terrorists, working with children and young people who were displaced by war, just like we're seeing Gaza today, just like we're seeing Sudan today, just like we're seeing in Congo today. Just you know, people were really passionate about going to spaces and places where money will not go to, but rather will be present and risk their lives for their fellow citizens and see what the art can do in making change happen in their communities. And that is the context of Nigeria. And that is what we've used to catalyze as a model, even in the global south or global majority, as you may call it. Nigeria happened to be the country with the highest numbers of people with sickle cell disease in the world. I have seen children, young people die of sickle cell disease. But never in the history of Nigeria was art used as a means of therapeutic purpose or support young people dealing with this disease. But through our art program, art in medicine, art, engagement was introduced to sickle cell community. And today, sickle cell center, which, was transformed from what it used to be, now looks like a museum. Now, young people who go for treatment look forward to going for a doctor's appointment, not because of the treatment the doctor is going to give to them, but rather because of engagement in the art. But looking, backward from working with children and those small numbers to children in oncology, I look at the progression and the movement we've seen with the founding of the Global Art in Medicine Fellowship Program, first as a program in Nigeria. And we can see, some of our friends, displaying their certificates. We're thinking about how do we nurture, the knowledge, not just move from passion, but passion is not enough. How do we understand what this is? Moving from poverty of not knowing to abundance of knowing and unearthing what we know to move forward to the unknown. And from there, we've seen the collaboration with, diplomatic mission and foreign missions in Nigeria, like the U.S. mission or U.S. Embassy in Nigeria that supported, the founding of the Global Art in Medicine Fellowship Program first, within Nigeria. And from there, doing exchange program for students and medical students in Nigeria for the very first time. All of these were not part of the student curriculum to think about how can we introduce the art to improve, even the knowledge of medicine for medical students. But what we did in Nigeria, or what we're doing in Nigeria, actually made that happen. And through that, we created our exchange program by, taking some of our medical students and small artists to University of Florida. You can see, my mentor here, one of my mentors, Dr. Jill here, and other, Dr. I can't remember her name, and other people were here, doing those exchanges in terms of, creating more understanding, creating more knowledge, creating more, advocacy around how do we move forward from what we don't know to what we need to know and to the unknown. And from what we've done with the Global Art in Medicine Fellowship Program to now seeing the spread of that, many, even post-COVID, during COVID, we move up, the fellowship program from Nigeria to a Pan-African program where professionals from about 13 African countries became interested in the knowledge of the healing power of the art through our program. What we started in Lagos, Nigeria as a local program without funding or major funding or a major funder in any way or private investors. And we see how that snowball into other cities around Africa, other countries in Africa, from Egypt, to Uganda, to Kampala, into different cities, to see what the energy and the passion that is so tangible that people were drawn in to see what they would like to do using the knowledge of what we have and see that how they can apply that within their own context in their own country. And with what we've done, we've seen how we've catalyzed that into a global movement to the founding of the Global South Art and Health Initiative, as you're seeing here, with the first convening in Egypt in 2023 in 2 cities, with participation from about 26 countries around the world. And moving from there to Doha, Qatar in 2024. And beyond that are also other pavilions, exchanges, and other festivals happening across cities within the Global South country because of what we started in Lagos, Nigeria, with little or no funding from private sector and all of that. So we've seen the progress of what this could be and to what that has led to into even the founding of the first National Art and Health Week in Nigeria, to the founding of the first National Art and Health Week in Egypt, and to the founding of the Young Leaders for Art and Health Initiative, which recently reached about 300,000 people within 2 months. As I wrap up this shortly, I would say the future of art and health is less of ego, but more of an ecosystem built on the value of care, respect, cultural humility, shared greatness, less solo, less silos, more community emerging, one city at a time, through education, advocacy, and collaboration with relevant institutions, groups, government, agencies informing policies and partnerships to integrate the art into health system, capacity building for the next generation, institutional structuring that honors all voices, decolonize, decentralize, and empathize, less judgment, more joy, more collaboration, less competition. Let's get the conversation going. Thank you very much, everyone.
Thank you so much. Thank you, Aline, Clyde, and Kunle for setting the tone for this conversation. I'm going to actually invite Aline to speak ever so slightly a little bit about her final slide. I think she was introducing some of the stakeholders in her in the Brazilian context.
Sorry. I know we are running out of time here, but I'm sorry for my internet connection. I am here at the event and it's raining a lot in Rio and I am using my phone data. But just a quick thing to finish my talk, that I did not have time to do it. I was like finishing with that we are happy with the festival, that we had 465 people here from Brazil. And then we have like delegates from outside of Brazil, and happy to be here to discussing this topic with Kunle and Clyde. I just would like to make a call of action. I think the arts and health is a field that is developing around the world. In Brazil, as I said, we are growing up. This festival is helping us to be connected and discuss more about it. I agree with Kunle that we need to be connected and funding is not enough. Funding is not the only thing. But in my experience, we have some challenge to do later. That is, one is most of the research is for English speakers. We don't have so much research in other languages. And when Kunle said we need to decolonize and we need to have more access to the information, as I'm not an English speaker, I speak Portuguese. And then this is, if you don't speak Portuguese, English, you are not going to access, because most of the research is made with white Americans and white Europeans. And then my call to action is like, let's go and do more research in the Global South, because we don't have so much research in our arts and health in Global South. I know it's like much more individual initiatives than maybe connection, but this kind of events and this kind of lives is good to be together and good to be strong. And my call to action is, I think researchers need to prioritize diverse populations, support multilingual research, and adopt community-driven approach rather than imposing external frameworks that may not fit different cultural realities. My second call is for the community. In the community, we must make arts programs accessible, culturally relevant, and embedded within existing community structures. Caregivers and families should be active participants, not just passive participants in these interventions. My third call is for the healthcare practitioners. They should adapt interventions to local needs and recognize that Western models of healthcare integration may not always be suitable for different social, economic, and cultural contexts. My other call is for the policymakers. They need to understand funding is crucial, but is not enough. We need structural change. Policies must go beyond isolated projects and evolve into sustainable long-term public health strategies, especially in Latin America and Africa, where this initiative is still developing. And then my last final call is for the artists. I think the artists, we are the key. We are the key of the transformation. We are the agents that we are going to transform this by collaborating with researchers, healthcare professionals, and community. Artists can shape interventions that are not only effective, but also meaningfully and emotionally engaging. Their work has the power to reach people in ways that traditional healthcare approaches often cannot. Thank you very much, and sorry for my connection, and happy to be here and happy to discuss later with you.
Thank you so much, Aline. Thank you, Clyde. Thank you, Kunle, for really speaking from the various stakeholders' experiences from Brazil, from the UK, Nigeria. Kunle, I'm going to ask you to actually speak up from the UK actually a little bit. I know you centered Nigeria there, and then Clyde from America, because some of the UK experience also includes the diaspora as well. So that's something I'll probably maybe touch a little bit later. I think something that came through in all of the conversations was around accessibility and grassroots. And I think, how do we center that, especially when we are inviting some of the other stakeholders? Kunle, you mentioned the American Embassy, for instance. So when we are working with some of our other partners, whether they're funders or delivery partners, how can we share the language around this accessibility and improving accessibility? And how can we also champion these grassroots initiatives who have been doing the work without the funding, who may not have the prestige? And I'm throwing that out to maybe all the speakers, but we can kick off with Clyde.
Thank you for that question. For us, it was really important to do some early work as we were forming this in and around our shared values. And understanding that our values needed to materialize both internally and externally, right? Internally by way of how we were working together as a group, and then externally as how we were expressing the project and considering collaborators and others. It also informed our decision making about things that we would and would not do. But also, if there was instances on the local project formation where folks were also collaborating for the first time, to take the time necessary to unpack any particular challenges that were sort of not aligned with the overall values and goals of the project itself. So what keeps me grounded personally is my set of values, how I want to move through the world as a human, as my elevated self, to continue that work and to stand on that, when it's being challenged.
Do you want to jump in here?
Yeah, probably just speak very quickly. I think there's need for a lot of mentoring. Like I said, right from what I've shared from the beginning, there were no role models for someone like myself. Even up to now, I won't say there's anyone, and I've said it to anyone that's maybe listening to me, apart from to say, oh, there's somebody who I consider more like a mentor to me from the global south country. There's no single person, none. Up to now, I've not seen to say this person, I'm inspired by this person's energy. That's what I'm doing. No. So what I'm doing now for my side is more of taking more of my time, even though when I'm not paid, spending hundred of hours every year. I'm mentoring people. I'm having long hours meetings. And I would say this, for instance, there are 3 or 4 festivals coming up. One is happening this year in December in Pune in India. Another one's happening early next year in India in I think Tiv Malay. Another one's happening probably in May in Abuja, Nigeria. And I will tell you, I'm right here, like Oyinda said, I'm here in England. I'm here, I'm a Nigerian living in the UK. Leadership has gone beyond you running everywhere. That's not leadership. Leadership is influence. It's just you being where you are and you just generate energy that travel across the world. But I think a lot of mentoring with Aline, what Aline said as well in terms of like say, with the funding and all of that. But I think we need to invest ourselves first. And I think that's what we need to do, start from. Because sometimes we're like, oh, we need the money from government. Then we can wait forever. Reason for underdevelopment today because we are waiting for government. People do not really care about how your well-being. But if we invest more of ourselves and start mentoring people, I think we can see changes gradually that can be catalyzed into policy and change that we hope to see. So for me, it's more of dedication and investment of ourselves and leadership in mentoring people and doing it unreservedly, doing it passionately and moving them forward. And I've seen a lot of young people who are coming forward today who are becoming maybe festival directors who never knew that one day because one of the things I've seen is more of with the art and health ecosystem today. There's a trend, there's a vibe, except you belong, you don't belong. That does not apply to us in a way. You don't belong anywhere. You don't have to belong. Like you belong to the community. That is where to start from, right? To say you need a big name to power yourself. You don't need a big name. What you need is to start with somebody, a knowledge from your community, and start right there. And a few days ago, I was having a session with the people in Abuja to see the concept they came up with, what they want to do in Abuja, in Nigeria, was amazing, incredible. And that's what we need to see. How do we nurture? How do we teach? How do we mentor? How do we invest of ourselves? Someone like Alina who has diverse global expertise. How do you nurture people right there in Sao Paulo or in your country? Someone like Clyde has been doing a lot of work. So it's more of every one of us here today to say, before government get involved, you get involved and start mentoring somebody. I think for me, that's where we need to start from.
Thank you. Alina, I actually did just to piggyback on that around mentoring, and obviously you work in the education space. How are we engaging with the younger set of arts and health workers to make sure that this is at the center of their practice? They're thinking about arts and health that intersection so that they are equipped for the future.
Yeah. Thank you for the question. In my opinion, education is really important. Education is important. If we educate young people, young children in schools, and if you include more programs in school, and then if the young leaders are prepared and then first of all, we need to talk about this subject in different places. And I agree with Kunle that we as leaders, we can together try to do initiatives, because if you are going to wait for someone to do something, we are going to just stuck in our place and then we are not going to move forward. And I think young leaders, what they need to do is like believe in themselves and then knock the door and ask and prepare a project and ask something to the person or the place that they're interested in doing something. I teach students in the university, and what I am saying to my students is like, you need to move forward. We need to prepare yourselves. You need to knock the door. The no, it's something that we say here in Brazil that I don't know if it makes sense in English, that the no is there. The no is always there. But you need to ask for the yes. If you don't ask for the yes, you are going to stay with the no. And I think this is my main thing to the young leaders. Just go ahead, prepare the projects, knock the door, and ask for more space. And as an educator, what I am trying to do, and as an advocate in my country, I would like to just talk more about this in different environments, and put people together and collaborate with people. And I think it's really important to collaborate and do initiatives, international, national, and much more like maybe as individuals, because as I said, funding is not enough, and we are not going to wait for others to do things. And then young leaders, they need to move forward and just do things, and yeah.
Thanks, Aline. I mean, we do understand that there is a bottom-up approach, but there's also a top-down approach that's needed. I'm wondering if, Clyde, you want to speak a little bit about maybe some government initiatives or ways that we can best interact in the future regarding the future of health, of arts and health. That does take into consideration some of these larger stakeholders.
There is a question for Kunle that I want to make sure is responded to. I'll be quick and just saying in our context, again, given sort of like the, this last election and sort of the policies that are underway right now at the federal level, it's really sort of shifted strategies, for many of us. And I pointed to the private sector because it's such a behemoth in our country, right? And part of the effort we're attempting to make, some of us, through sort of like the institutional level, and advocating, is sort of that last bullet point around sort of new innovative forms of investment. Um, Now, the key around that for us is that those investments shouldn't only be driven from the top down. Those investments need to be informed by the people actually doing the work. And, that is a acquiescence of power, meaning that if you're the one holding the purse strings, you actually don't get to be the only one making the decision. And you have to change your own value proposition around the expertise of the practitioners themselves, and trust in uh, the forms of investment that they will help shape and guide. So we're attempting to do this, have this conversation, through the federal banking system, inside the United States, framed around social impact dollars, which are dollars that are already invested around climate change, around, healthcare systems, around economic development, alleviating poverty, but making sure that arts and culture is present, and also all of those people doing all of that work are informing how those investments happen. It's a lift. It's part of the work that we're doing. It's not paid work. It is advocacy and some activism to change the frame.
Yes, agreed.
I just,
Thank you.
I just, just a quick comment, because I know Kunle needs to answer the question. Just, I think one important thing that that we need to think about it is about the connection between public and private sector. Maybe not only the public sector, and this is maybe things that Kunle is like have been doing for many years, like not only public sector, but trying to connect with the private sector. And in the United States, I think this is a thing that worked really well. And in Brazil, we have the public system, we have a big health system, we have this integrative practices that is inside of the health system, that is a public idea, but we also can ask for private money and maybe combine private and public initiatives that could be help us to develop more, because we know we need money, and we need to just to live. We need to receive money, and then it's sometimes the government is not gonna give us all of the money, but we just can maybe combine both if we can.
Yes, exactly. I think there's a role for both public and private partnerships in order for us to deliver it. The government, even though they have the figures, sometimes they don't have the funds, and private sector seems to have the funds and maybe not the ability to identify or channel to resources. So I do believe that there is a place for the various stakeholders to collaborate with the wonderful work that's being done on the ground. Kunle, there's a question around how young artists can speak to health centers to allow them to volunteer for painting sessions for patients, considering some parts of Nigeria don't believe or want you to have a big name, don't believe in maybe the work that's being done, or want you to have a big name or be from a big organization.
Yeah, thank you so much. I'm going to respond to that very quickly, then maybe say something very briefly on the policy thing. I think, I mean, given the example, you saw what the picture I showed you from the very beginning. There was nothing like trying to do anything big. Oftentimes we're confused. We want to do something very large, something very monumental. Sometimes that is not what it is. Sometimes it could just be using a crayon on A4 paper. Sometimes that is the beginning of it. Leadership is about having traction before attention. What's your tractions? So sometimes people will not give you permission because you don't have traction. Even just the smallest things you've done, if you show this institution what you've done, that could create opportunities to get invited in a way. And if that is not the case, we know we do a lot of stuff around already in Nigeria already with the art and medicine project and all of that. You could just write us and then we can interview you, give you the institutional support, like what we missed, what I missed. In Nigeria where there's no institutional support and then I have to do a lot of groundwork. Well, we've passed that now in terms of like saying now we have institution, we have stuff like that. We can be that backbone for you in a way to be able to get in. And then talking about getting in, I'm going to speak into like the policy that you just spoke about now. One of the things we've been doing around policy in Nigeria is trying to get the gatekeepers to become insiders. So there are gatekeepers who are people who are within the government. Maybe they are SSA to the governor and all of that. Getting them involved to be part of training, like Aline mentioned, get them in. Make them part of the training of the fellowship. Make them, and we've seen that even within public hospital, we're seeing director of health centers becoming part of the fellowship program. Few years ago, we saw a vice chancellor of a university becoming a fellow in our fellowship program, a vice chancellor of a university. And then we've seen a lot of changes happening. Why? Because now we are opening doors to get the gatekeepers. Because sometimes when we want to make change happen, we might not need to get inside, but we can get an insider. If you can get the insider, then you can get this change inside. So sometimes it's about shifting narrative or to say, there's actually no specific route to getting this done. It's not linear. You could just spin it around, get the people inside. And talking about that as well is what we're saying with the private and public collaboration with what is probably going to happen in Abuja to see what the team are working on now to get banks who are probably having CSR and all of that to align the program design that meet the CSR, the corporate social responsibility of the bank, and to make them commit to the festival and then to say, now fund this project. So we're saying that. So I think it's also understanding the needs of private institutions, what they are really invested in, what they are really interested in, then pick that, they catalyze it into a program design in a way that become part of an initiative that can be funded. Because sometimes people will hardly fund what they are not passionate about. I mean, tell me, come and say, we've seen that somebody says, come and fund HIV/AIDS. I will probably fund malaria. He said, what is mine with HIV/AIDS? I'm not going to do that. So I think for us as practitioners is understanding the needs of institution and now we design, even like I know Clyde have mentioned like the people at the grassroots, but I think understanding even people at the grassroots need to start mapping and understanding the needs of the people that will need their money and how we pick that and catalyze into a program design that become part of our ecosystem. And then we can probably have 1 or 2 or 3 artists who are interested in that direction and they start moving forward in that direction. So for me, it's more of understanding assets and harnessing asset and advancing the asset.
Yeah. So I mean, I'm gonna try and just condense a bit of what has been said today, and then I'm going to give you all the opportunity to just do closing words on what you think the future of arts and health is, either on a global or just back down into the regions that you operate in. But I think one thing that came in, and it was the last statement that Kunle made, was around language and around communication. The different speakers touched on it in different ways. So Kunle spoke about speaking the language of the different institutions and stakeholders that we are engaging with. Aline spoke about the fact that we need research in a variety of languages and not just centering English language when we talk about the importance of arts and health. And Clyde spoke about plain language reports. So actually the people who are benefiting from some of this work can actually understand it. And it's not the scientific, mumbo jumbo that cannot really be interpreted on the ground. And so that's why I'm actually think here that one of the take homes for me is going to be around language. So I'm going to center that as my takeaway. I'm going to also, yes, so I think that for me is going to be the future of arts and health is around speaking the multilingual, is having a multilingual approach. I'm going to let Aline speak with just her last statements, then we'll go to Clyde and then final words from Kunle.
Yeah, very, very well said, Oyanda. Thank you very much. I think for me, it's communication, is culturally adaptation, is connection. It's like this is the future of arts and health. And for example, these big projects that you were organizing in United States, Clyde, let's translate to other language. Let's translate your websites to other languages. Let's translate to Spanish. Let's translate to Portuguese, and let's like put this information out of United States. The same, I know, Kunle, you are working with international people. You are working with people with different languages as we can, as most as we can, translate this to other cultures, that translate this to other people, because sometimes people are in the internet. As the internet is there, I think my internet again is like not well, but again, internet connections, websites, and translate from different languages. Thank you very much, and I'm happy to translate to Portuguese if you need someone Portuguese speaker.
I love that. Translation is key. Doubling down on the language piece as a vital piece of accessibility and knowledge transfer. I'm gonna quote Picasso. So I was born and raised in New York City, and I currently am based in Dallas, Texas. They can't be more different cities and geographies in the United States. And one of my mantras upon relocating to Dallas, to double down on something Kunle said, was that great things are actually a series of small things put together over time, you know? And for me, it was important to do a series of small things over time in Dallas as I integrated myself into that community in a meaningful and authentic way. So I'm just doubling down on that, from what Kunle shared. And I think the other key is collaboration, as difficult as it can be, to embrace it, and to use another word in Kunle's presentation, live in a spirit of joy around that work, because this is about life and living. So, yeah, thank you.
Thanks, Clyde.
Yeah, my final word would be visionary. We are all missionary. Let's get moving. The future is visionary. We are all missionaries. Let's get moving. Let's get it done. And the world will get better because of it. Thank you so much.
Thank you so much. Thank you to Aline, Clyde, Kunle. That was a really great and exciting conversation. Most of our 3/4 of us are joining you from live from the Arts and Health convening here in Rio, Brazil. And so many activations are taking place. Aline spoke about the number of guests who have come in from variety of spaces, local and international, to join us here to discuss the Global South, the impact of arts and health and to advance the field. It's very exciting to join you all virtually, and we will do our best to keep you all abreast to some of the conversations that we're having here via social media and our website page. And for those of you who are joining us live at the event, we shall see you